So, good morning everybody. My name is Anne McCluskey. I'm a doctor here in Derry in the north of Ireland, and I'm doing this wee video from my back sitting room just to have a yarn with you about where we are. I have been intending to do this more regularly, but to be honest, there's such an amount of really good data and good information out there and available on alternative sources that, you know, from people who are much more eloquent and much better qualified than I am to speak on this. But I just thought maybe I'd give you a wee local update and a local perspective. So we're sitting here in Derry on Black Friday, and it's appropriate name because we're in full lockdown again. I got my hair cut yesterday, but I can't get a cut today. And I don't know about the rest of you. I'm losing track of the things that we are and are not allowed to do. None of this makes sense anymore. So that we know that this viral infection, SARS-CoV-2, which causes COVID-19, is not anywhere near as lethal as we first thought. We know that the ludicrous modelling of Professor Ferguson, which told us that 510,000 people in the UK would die without lockdowns, and more recently that 4,000 a day. You know, we had Chris Whitty and Valence talking about the pretext for these new lockdowns. These models have no basis in real life data, and we have wonderful work going on, really good work based on Office of National Statistics and, you know, hard government data right across the island of Ireland and across the UK, which shows that this disease is not particularly dangerous. It tragically, as viral illnesses do at this time of year, takes in its path the very old, the very frail and the very vulnerable. We know that 99.5, maybe more, % of people who get COVID recover, and that the case fatality rate, that is the people who are infected, is a fraction of 1%, probably 0.2%. And again, the global mortality right across all age groups is infinitesimally small, somewhere in the region of 0.03%, which, you know, is again overwhelmingly in the very vulnerable. People under the age of 40 are pretty, you know, I think there's, since the beginning of all this, and it's difficult to sort out the data because the whole thing's cumulative. Nobody gets better, and people who die within 28 days of a positive PCR test, and I mean, I've already spoken about the enormous amount of false positivity in these PCR tests, but people who die within 28 days of a positive test, really no matter what they died from. And indeed, we just had a letter recently from Dr. Michael McBride reiterating that a positive test is not actually required for COVID to be mentioned on a death certificate, which seems strange, but this is the advice that has been given to physicians from government, so that it's really difficult to pin down this data. They also have changed the PCR tests, as we know, particularly in the community wing of this, where there's extremely low levels of infectivity, where you have a test with even a very small false positive rate, where the true levels in the community are very small, then almost all of your positives, if you like, are sucked up by that false positives, because the false positive rate refers not to a percentage of the positives, but a percentage to the entire tested population. So I hope that's understandable. I mean, there's some very good information about that, which you can get on the internet. So in 2019, the World Health Organization published guidelines about pandemic management, and quarantines of affected individuals were not recommended when the virus is established in the community. And lockdowns weren't even discussed. It has never been considered that we lock down entire populations of healthy people in order to try and control the disease. And we now know that there are at least 22 published papers, peer-reviewed papers, showing there's no correlation between lockdowns, the stringency of lockdowns, how early the lockdown happened, how compliant people were. There's no correlation between lockdowns and deaths per million. Right across, I think it's 190 countries internationally, and certainly 50 countries in one that was published in The Lancet. This pandemic has followed similar curves across Europe. You get this Gompertz curve where you get a surge and then a tailing off. And as we can see now, a seasonal resurgence at this time of the year. The data analysis is further complicated by the fact that they are now no longer counting flu, respiratory pneumonias and things like that as a separate entity, so that the whole thing is lumped under sort of, you know, COVID morbidity, which again obviously muddies the waters a bit. But I suppose today what I wanted to talk to you a wee bit about was censorship and disinformation is the word we hear a lot about conspiracy theorists, and the requirement to clamp down upon people arguing with the government's narrative, despite the fact that we see chief medical officers, chief scientific officers, ministers for health and our prime minister blatantly lying to the public. And something very similar is going on in the south of Ireland. We have people speaking in contravention of the known truth. Using the word liar is not very politically correct, but these people are saying things which they know are not supported by data. And as a scientist, I find that deeply troubling. And I'm also deeply concerned about the enormous conflicts of interest that exist between, shall we say, commercial interests who are providing test and tracing and, you know, the pharmaceutical industry and stuff like that, and the people who are promulgating the narrative around this being a desperately lethal disease and that we must remain locked up until such times as a vaccine becomes available. And even then, as Luke O'Neill has said, we're still going to need to be masked and we can't have any sort of normal social interaction. And this is absolute anti-science. It's nonsense. So we've had some really, really incredible initiatives across the world. Notably, I suppose, I wanted to talk a wee bit about the Great Barrington Declaration. Now, the Great Barrington Declaration was a cooperation between some of the most eminent scientists and immunologists and epidemiologists across the world. We have Dr. Dev Bhattacharya from Stanford, who's an epidemiologist, a physician, public health policy expert. Dr. Sunitra Gupta from Oxford, again an epidemiologist with expertise in immunology and mathematical modelling of diseases. And then Dr. Martin Kulldorff, Professor of Medicine at Harvard. And these people got together and put a balance of benefits and harms of lockdown and argued very cogently and very coherently about the requirement to open up society, allow societies and communities to develop endemic immunity, which is what has always happened in these viral illnesses since the dawn of time. And yet the thing was pulled from Google search engines and absolutely censored. And yet we can listen to Boris and Pratt Hancock and Whitty and Valence and people like that who are talking about models rather than looking at real world data, and who are blatantly, they're talking nonsense, and yet these people are not censored. Worse than that, apart from you know the disinformation and is the mainstream media simply turn their backs when any of these initiatives happen and just ignore it, and it sort of disappears without a trace. Likewise, here in Ireland, we have the same sort of a very, very eminent group of scientists and doctors talking again about focused protection, about caring for the vulnerable while allowing society to open up. The Great Barrington Declaration. I think there's 36,000 medical practitioners who signed it, 12,350 medical and public health scientists, and 614, that's over 500,000 concerned citizens. So this is an important thing. And here in Ireland, we have a thing called a white paper, which has been published recently, again by a group of eminent scientists and physicians here in the 26 counties. And you'll get it again at www.covidrecovery.ie. And this white paper now is about 2 weeks old. But again, there's been I did some interviews about it on the media. I'm very proud to have been an early signatory. But there's not been a huge amount of coverage of it in the mainstream media. And really what these scientists and doctors are talking about is what we already know, is that lockdowns and contact tracing and isolation and all of these pathetic attempts by governments to control something which is uncontrollable, that is the spread of a virus. These are imposing enormous health costs, particularly health costs and economic costs, particularly on the poor, the vulnerable, and people who are at the margins of society, while providing really no protection from disease. In the hospitals, we hear a lot about how busy the hospitals are, and this is absolutely true, but this has been true every winter for decades now, since the NHS was sliced off and privatised and sold off to the highest bidder, and under-resourced and underfunded. And we see, for example, that in the 6 counties of the north of Ireland, we have 3,000 nursing places not filled. We have one of the lowest intensive care bed provision per head of population in the developed world, and this is true of the whole of the UK. So that it stands to reason that at this time of the year there is going to be a seasonal resurgence of people who are vulnerable and who have respiratory disease and who will be tipped over into requiring hospital care by a viral illness. But the fact that there has been no special provision made for these people is absolutely scandalous. We have thousands of beds less than we had at the height of the epidemic in the months of March and April, because of the requirements of social distancing and the new ways that the hospitals are having to operate. And we know that within the NHS, and the same is true across the island of Ireland, that there are tens of thousands, it has been estimated 200,000 excess deaths from non-COVID related causes. That is ischemic heart disease, strokes, delayed cancer diagnosis, and all of this is happening because of the non-availability of usual services. And this is not, this is not being factored into the government's. It's just all about COVID, and none of these other very, very important things are being taken into consideration. So in the hospitals as well, it's all about admissions, and there's no talk about turnover. The average length of stay is only a few days. People go in, they get stabilised, they get started in treatment and get discharged. And also our understanding and knowledge and treatment modalities for this disease are immeasurably different to what they were way back in February, whenever people really didn't know what they were dealing with. So, the censorship, we can see, I don't know how many things I've shared and put up on Facebook. Really good. These are not insignificant people. This is hard data, and within an hour or two, it's taken down from Facebook. And we see now that there are battalions, literally battalions of people, so-called fact checkers, who are censoring people like Carl Hennigan, who is a professor in Edinburgh, in Oxford. Eminent scientists, eminent physicians, eminent researchers, data analysts are being fact-checked by largely failed journalists. It's quite incredible. And we can see the whole network, and I thank the team at the UK Column News for this, because they did a very, very erudite explanation of the whole network of government censorship to make sure that the public don't receive information, no matter how factual, which argues with the government's narrative. So there are 14,000 employees in the Cabinet Office. We have the National Security Council. We have Government Communication Headquarters. We have the Security Service MI5, Secret Intelligence Service MI6, Joint Biosecurity Centre to provide evidence-based objective analysis to inform local and national decision-making in response to COVID-19 outbreaks. These people are all working hand in gloves. We have the Rapid Response Unit identifying false narratives and working with departments across Whitehall to deploy the appropriate response. We have the National Security Communications Team. We have the 77th Brigade, which is an army unit headed up by General Sir Nick Carter, formed in 2015 and renamed. It's based in Denis and Barracks in Berkshire. They have a behavioural insights unit, which is concerned with the psychological programming of the nation to accept the government narrative. And they're particularly interested in digital communication. And their remit is to fight disinformation about the coronavirus. We have the 13th Signals, again, another unit of the British Army. And they have a Department of Communication, Media and Sport. Sorry, no, the 13 Signals are a separate, they're an army unit. And then there's a Department of Communication, Media and Sport, which has been called the fake news unit. And these people are censoring, as I say, virologists, epidemiologists, statisticians, infectious disease specialists. And while allowing, I mean, on Sage, there are very few actual of these experts of this calibre who are given advice, and yet these people have untrammeled access to the airways. So we're living in an extremely non-evidence-based age, and none of this makes sense. And every day, you get another barrage of factual information, and then you turn on the radio, and it's nonsense. People are dying. I speak about the NHS. Every day in the UK, at this time of the year, about 2,000 people die. And, the vast majority of those are people who are expected to die. And there are outliers. And tragically, young people die. And people die of a myriad of causes. And yet the only thing that seems newsworthy now is deaths attributed to a single respiratory virus, which is within the envelope of what happens in a normal flu season. This is a particularly bad and nasty virus, which is similar in its behaviour and its transmission and in its mortality effects to the seasonal flu. And yet we are treating it in a way that we have never, ever behaved before, at huge cost to our society. So here on Black Friday, I was listening to a comedian saying that I'm a celebrity, get me out of here. I actually have more freedoms now than the average punter on the streets. And I just look at the frightened faces in my town, and when I'm working, it pains me to see how little expectation people have of getting help from their health service. And I find it distressing. So, we'll battle on. I wish you all happy Black Friday. Try and support your local businesses as opposed to the multinational giants this Christmas. I appreciate how difficult that is when you don't have access to all of your local businesses. But it's not boding well for Christmas, but who knows? Maybe the government will keep its word and let us out in 2 weeks' time. Here's hoping. All the best. Bye-bye.